Hello, my name is Elizabeth Kizak, and today I'm going to talk to you about Alzheimer's disease. Alzheimer's disease is the sixth leading cause of death in the United States and the fifth leading cause of death for those aged 65 years of age and older. Currently, 5.4 million people in the United States have been diagnosed with Alzheimer's disease or some form of dementia. Today, I'm going to talk about what Alzheimer's disease is, warning signs of Alzheimer's disease, symptoms of Alzheimer's disease, and the 7 different stages of Alzheimer's disease. After I've talked about this, I will talk about the current treatment options available for Alzheimer's patients and to help Alzheimer's patients when you are a caregiver. Alzheimer's disease is a brain disease that affects memory, thinking, and behavior. Scientists believe that over time, nerve cells start to lose their connection with each other, which makes it difficult for nerve cells to perform their duties to tell the brain to perform such activities as learning, thinking, and remembering. Scientists have also discovered that patients with Alzheimer's have an increased number of tangles and plaques in their brain, which are believed to play a critical role in blocking communication with nerve cells, which block them and make it difficult for nerve cells to connect to the brain to help with learning, thinking, and remembering. Some warning signs of Alzheimer's are when the patient has memory loss that disrupts daily life, the patient has challenges in planning or solving problems, a person has difficulty completing familiar tasks at home, at work, or for fun, and a patient has confusion with time and place and doesn't know where they are. The patient has trouble understanding visual images and spatial relationships. The patient starts to have new problems with words in speaking or writing them. The patient has difficulties misplacing things and losing the ability to retrace their steps. They have decreased or poor judgment. The patient has withdrawn from work or social activities in their everyday behavior, and also the patient is starting to have changes in mood and personality. Some symptoms of Alzheimer's from the DSM-4 criteria are that the patient has the inability to generate coherent speech or understand spoken or written language. The patient has the inability to recognize or identify objects, assuming the patient has intact sensory function. The patient has an ability to execute motor activities, assuming they still have the intact motor abilities, sensor function, and the comprehension of the required tasks they are being able to ask to do. The patient has the ability to think abstractly, make sound judgment, and plan and carry out complex tasks. Lastly, the DSM-4 states that decline in cognitive abilities must be severe enough to interfere with daily life to have the diagnosis of Alzheimer's disease. The disease of Alzheimer's has 7 different stages. The first stage of Alzheimer's is called no impairment. In this stage, during an interview with a medical professional, the patient with Alzheimer's does not show any signs of memory loss or confusion at this point. The second stage of Alzheimer's is called very mild cognitive distress. During this stage of Alzheimer's, the patient may feel like they are forgetting or having memory loss. The patient is forgetting everyday familiar things such as words and locations. The third stage of Alzheimer's is called mild cognitive decline. During this stage, family and friends of the Alzheimer's patients start to notice difficulties with the patient's memory loss and concentration. Also, the Alzheimer's patients have noticeably greater difficulty performing tasks in social and work settings. During the mild cognitive decline stage also, Alzheimer's patients start losing or misplacing everyday valuable objects. Lastly, during the mild cognitive decline stage in Alzheimer's, patients start having increasingly trouble with planning or organizing everyday activities. The fourth stage of Alzheimer's disease is called moderate cognitive decline. In this stage, there is a point where the medical professional once again has an interview with the patient, and the medical professional at this point in time should clearly be able to detect that the patient has a problem and can be diagnosed with Alzheimer's disease. At this point in time, the patient is having problems forgetting recent events. They're experiencing inability to perform complex mathematical equations, such as counting backwards, starting at 100 by sevens. The patient also has an increased difficulty performing such tasks as paying bills, planning dinner, and everything that requires more than 2 steps. In the moderate cognitive decline stage, Alzheimer's patients also have problems starting to forget their own personal background history. And lastly, in this stage 4 of moderate cognitive decline, Alzheimer's patients start to become moody or withdrawn in social situations. Stage 5 in Alzheimer's disease is called moderately severe cognitive decline. In this stage of Alzheimer's patients start to have gaps in memory, and the patient noticeably needs help with day-to-day activities. At this point, patients become unaware where they are at certain times and what the date and time it is. Also, in the moderately severe cognitive decline stage, patients have difficulty counting backwards with less challenging mathematical equations, such as starting at the number 40 and counting back by 4s. Another symptom in this 5th stage of Alzheimer's disease is that patients need help dressing themselves for the correct seasons. For example, the patient will put on summer clothes in the winter time and winter clothes in the summertime. During this 5th stage of cognitive decline in the Alzheimer's disease, this is the final stage where patients will not require any assistance in eating habits or bathroom habits. In the 6th stage of cognitive decline, called severe cognitive decline in Alzheimer's disease, the patient's memory starts to worsen and the patient needs extensive help with everyday activities. Patients also lose awareness of recent experiences as well as their surroundings. In the 6th stage of Alzheimer's disease, patients start to have problems distinguishing familiar and unfamiliar faces and have trouble remembering the names of even their spouse and caregivers. In this stage also, Alzheimer's patients experience major changes in their sleep problems. Alzheimer's patients at this point in time start sleeping all day and become restless and awake at nighttime. Lastly, during the severe cognitive decline stage, Alzheimer's patients experience major personality and behavioral changes, including being suspicious and delusional of people and places around them. The last and 7th stage of Alzheimer's disease, called very severe cognitive decline, is the last stage of Alzheimer's disease. In this last stage, patients regress to the stage of having the same needs such as a baby or a toddler. Individuals with Alzheimer's disease in this stage lose the ability to respond to their environment, to carry on a conversation, and eventually to control their own movements. Now that I have told you the warning signs of Alzheimer's disease, some symptoms of Alzheimer's disease, and the different 7 stages of Alzheimer's disease, I will tell you about the current treatments that are available for our Alzheimer's patients. Currently, there are no cures for Alzheimer's disease, but there are treatment options that will help with behavior and cognitive difficulties that Alzheimer's patients are experiencing. To help with memory loss, the FDA has approved 2 cholesterol inhibitors to help treat memory loss, confusion, and also problems with thinking and remembering. Sometimes also medical professionals prescribe vitamin E for Alzheimer's patients to help with cognitive changes. To help with behavioral and social changes during Alzheimer's disease, to help keep the patient active and more aware of their surroundings, it is good for the patient to keep active in their social community by being involved in keeping up with daily activities and people in their surroundings. With an estimated 5.4 people diagnosed with Alzheimer's disease, I hope you now have the knowledge to watch out for signs and symptoms and the different stages of Alzheimer's disease in people in your community and the loved ones and the family that you take care of every day.